Hi, this is Dr. Mark Sanna, and welcome to this episode of the Level Up Podcast. This is a podcast that connects you with the people, the ideas, and the strategies that help you bring your practice to the next level. And I am really stoked today to have my buddy Dr. Rob Hannipole with us. And Rob, thanks for being with us today. I appreciate it. Rob and I go way back, and he has been in chiropractic industry. How many years are you a
Oh, 30 something years.
Yeah.
It's been a long time. It's been a long time.
But
But came from a different industry, thus I guess this conversation today.
yeah. And Rob has always been an innovator, an entrepreneur, thinking outside of the box guy. He's helped breakthrough coaching members for many, many years. Uh, Everything from writing their books to expanding their practices. And now he's developed a very unique niche and a way to make practices stand out in the crowd. And it's a great, great model. I like to say it's lean and mean. And I really see this as the future of chiropractic practices. So, Rob, tell us a little bit about your background so that folks can get to know you a little bit. And then we're going to talk about the laser centers.
Absolutely. Well, my background actually started out in the business world. I graduated my undergraduate at University of Maryland and graduated with a business and marketing degree. I worked in Manhattan in management and marketing consulting, corporate image, identity, positioning for Fortune 500 companies.
Mm.
Would sit in boardrooms and come up with plans for these
Oh
companies
yeah.
thus just an easy transition to chiropractic, right? But but I
Not, not
literally
so much.
I loved what I was doing and I loved the creativity of what I
Yeah.
was doing, but I hated the corporate world.
Yeah.
Hated it. I hated the politics
Hmm.
and I
Oh
felt
yeah.
too much like an entrepreneur.
Yeah.
So, when I was 16 years old, I was introduced to chiropractic and went to a chiropractor in Livingston, New Jersey. I'm from the West Orange, Livingston area and loved it. I loved all the brochures I read, and the posters in the office, and it made so much sense to me. Not knowing that that was going to be a career that I'd be involved in the future. But when I was working in New York, I realized, listen, I hate the corporate world. But
Hmm.
I find myself, on lunchtimes, actually walking, going into chiropractic offices and natural health offices and wellness facilities and wellness doctors, Whole Foods type of markets. And I was like, that's really where my interest is.
Yes.
So I got to get out of this corporate BS nonsense. And I am more of an entrepreneur. I'm going to really pursue chiropractic because I love the philosophy of chiropractic.
Right.
I love it.
Right. Yep.
Absolutely. But I want to do more within it. So that was
Hmm.
always my plan. But only to open up an office back in 1995 was my first office. Amongst I've had multiple offices through the years, but
Yes.
the first office is still doing well in Florida, and that was my first location. But literally for years, I kind of got stuck working in the business,
Hmm.
um, and not really working on the business or the profession as much as I really wanted to. And
Rob, I had a coaching call with a guy this past week, super busy, right? Going, 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 very successful practice. And I couldn't get the guy on the phone. And when I got the guy on the phone, he'd be getting pulled to a patient or coming from a patient. And finally,
right,
I had to sit him down and say, listen, you ever read Stephen Covey? Oh, yeah, I read the book. Working in your business, working on your business. I said, yeah. He said, oh, sure. I read it 3 times. I said, good. We're
yeah,
going to put it in practice
you got
now.
to follow it, right? Michael Gerber, right? The email.
Exactly. Yep.
Love
Michael
it.
Gerber.
I
Yes.
recommend that all the time to
Yeah.
people because that really was a big shift for me when I read that, right? I mean, you could
It's a
either be
game
the
changer. Yeah.
technician, the entrepreneur, the manager. You
Yeah.
can't, it's so hard to, but so many, chiropractors have to be all three, at least at
That's
some
true.
point. but then you really need to learn to delegate,
Totally.
you know.
Totally.
That's
Yep.
the key. That's the key.
Mhm.
But
Agreed.
again, and you find that some chiropractors actually love being the technician.
Yep.
That's what they want to do. That wasn't me,
Right.
you know. I
That is not
definitely
you.
I like the entrepreneurial hat, more. I love seeing patients when I want to,
Yes.
but I don't feel that I need to do that every day. I think I see a bigger picture, and I literally feel that with what we're doing now, I'm actually affecting more lives, whether it's, on the
For
doctor
sure.
side, from the business to business side, right?
Yep.
But also more lives from the consumer, the patient side.
Well, it's true. Every doctor that you work with,
Right.
their patients are your patients. That's,
Exactly, exactly. And
yeah.
we get texts, every day, about, even last night, a great success story. And
Miracles.
and
Yeah.
that's not a local, it's not my local practice. So I feel like I'm having more influence over, more doctors and
Yeah.
more great, patient outcomes by doing what we're doing now
So cool.
and having
So
a local practice.
obviously, the chiropractic market industry has changed significantly over the past few years. We were chatting before we came on, and the challenges that every chiropractor has about staffing, employees, ghosting,
Oh, it's
not coming.
unbelievable.
It's a
Yeah.
regular happening, and now it's more the norm. And so overhead going up and reimbursement going down, right? There's some places Blue Cross is paying 20-year-old fee schedules. And 20 years ago, you could pay your front desk $11 an hour, right?
Not anymore.
You can't even work at McDonald's for $11
No,
an hour now,
no.
right? So the whole thing has changed. And you've created this new business model in response to that, right? And tell me a little bit about how you kind of put two and two together to come up with this new concept.
Yeah, well, because I got sick of pulling my hair out.
Yeah,
Literally, I was experiencing it in myself, and I said, okay, I have to identify, why I felt the frustration that I felt,
yeah,
and identify literally what are the main challenges, what are the main problems that we experience as chiropractors,
yep,
and then how can I have a solution for each? Okay. So
yep,
the first problem that drove me up a wall, drove me crazy, was that we were literally only seeing maybe, depending upon who you speak to and what literature you read, we're seeing 10, 12% of the population.
that's true.
But the other 90%, 88%, 85% doesn't want to see us, and they don't want to see us because of misinformation, or they heard somebody's brothers, uncles, aunts, cousins, sister, gave them some bad news about chiropractic, But we had a credibility problem, a public awareness problem, a
We got a
positivity
branding
problem.
problem. Yeah, for
What's
sure.
that? Yeah, yeah. So that drove me nuts.
Yep.
The second thing that really got to me was that patients typically will go to a chiropractor from a 5 to 7 mile radius. Okay.
Hmm.
We have an amazing philosophy. We have an amazing way to help the world. But people, only drive about 5 to 7 miles because they all think that a chiropractor is a chiropractor is a chiropractor is a chiropractor.
Yeah.
Because if I did some kind of upper cervical technique and you did some type of sacral technique and somebody else had I don't know, the earlobe technique, whatever it is,
Yeah.
we all think that we do something special, and we all probably do something special, but the public has no idea.
Public doesn't know.
Okay.
Exactly.
We don't have,
Yep.
there's not this major public awareness campaign and not all over the news about these different techniques. So in the eyes of the public, Mark, chiropractic is a commodity.
Correct.
All
Yeah.
right.
Unfortunately, but it's true. Yeah.
It's a
Mhm.
commodity. Drove me nuts.
Yep.
Okay. Again, another real pain point, real frustrating point to me. All right.
Yep.
Number three, back and neck pain. All right. You ask anybody, what does a chiropractor do? 99% of the people are going to say, oh, they treat back and neck pain.
Right.
Okay. Again, as much as we don't want to believe that, as much as we know, we do so much more. And, there's so many types of chiropractors, but we know that we can affect the whole body. And the portal of entry into the body is through the central nervous system. Okay.
Right.
But patients, the public, the world, they think that we treat back and neck pain. All
Yep.
right. So that was point number three. And point number
Hmm.
four was, you know, if somebody already has a chiropractor, but I can do other things to help the patient that they may not do, that person's generally not going to come to me because, again,
Think
they
I'm a
perceive
chiropractor.
that we
Yeah.
all do the same thing, right?
Yep.
So I really, pondered this and I really thought about this for a while. And I said, how do I have a solution for this?
Mm.
Well, at the same time, I was using some great technology in the office. I got into laser therapy many years ago,
Yes.
literally with the class 3B lasers.
You're right.
It's like the Microlight 830 or something. I
Yeah.
think it was like 90 milliwatts. And I read a study about using that on General Motors employees. I think it was like around 2,000 employees with carpal tunnel syndrome. And yeah, it fascinated me. And I
Yes.
was always into, learning about energy and
Mhm.
physics and quantum physics. And so I loved laser. So I had all these, class 3 lasers, 3B lasers. And as lasers started to evolve, I started getting into class 4 laser. And,
Yeah.
that could be a whole nother discussion about the class 3 and class 4. But I prefer class 4 lasers
Mhm.
very much over the class 3. But I realized that patients started to come see me specifically for laser and
Right.
getting referrals for laser that really weren't even interested in chiropractic. Okay.
Yeah. Yeah.
So I had an idea in the shower one day. Okay. I literally had an idea in the shower. I call it a wet dream. Okay.
So the
But,
best ideas come.
but literally, exactly, because you're in what's called transient hypofrontality,
That's exactly right.
right? Meaning, again, my prefrontal cortex just completely just, relaxed.
Yes. Yes.
And it came to me that, wait a second, laser and the other regenerative technologies, but I like the word laser because it
Yep.
lends itself to what I'm going to tell you. But laser was really a business model in my practice, not just a piece of equipment.
Hmm.
And then I thought about it further and I said, geez, if I'm a chiropractor with a laser, then I'm still a chiropractor with a laser. But if I create another business model based upon laser and regenerative technologies,
Yeah.
now I have, a degree in chiropractic. I'm blessed to have a degree. I mean, it's wonderful, but the public is going to come see me for something that may not be chiropractic, but I'm going to be positioned as more of a specialist
Yes.
or other conditions. And then I can gently teach them about chiropractic if,
Yeah.
if I feel
Hmm.
it's
Have the
necessary,
opportunity
right?
then. Yep.
Right. So, I'm going to put on the screen right now for those that are actually watching and not listening, but this is what came to my mind.
Yeah, there
Okay.
you go.
All right.
Yep.
Dunkin' Donuts and Baskin Robbins. And you may say, well, wait a second. What does Dunkin' Donuts and Baskin Robbins have anything to do with laser and chiropractic? But it
Yeah.
has everything to do with it, right?
Yeah.
Because our motto right now, and it took a long time, okay? Because my company's called the Laser Masters, and our
Yep.
centers are called ReliefNow Laser Centers.
Hmm.
But our motto is two practices, one roof.
Hmm.
Okay. So if somebody is going to Dunkin' Donuts, they're not interested in their dessert. They're not interested in ice cream. And if somebody wants ice cream, they're generally not interested in donuts and coffee.
Yeah.
But you have two businesses sharing the same space, reaching economies of scale in that
Right.
space. Okay. You're not, if you want to go open up another practice, you're talking, $100,000 or, whatever it is. You
Mhm.
don't
Oh
have to
yeah.
do it because you already have, like, as Catherine Ponder would say, you have acres of diamonds in your own practice already.
Yeah.
Okay. So, again, for anyone watching, this is the model right here, right? Smith
Yes.
Chiropractic. And now we have Smith Chiropractic. And then we have a Relief Now Laser Center. Okay.
Right.
And we get patients coming for the Relief Now side. And they'll actually come into the office and they'll say things like, "Oh, you have chiropractic here too."
Yeah.
Okay. And then you get to
Yeah.
introduce them because listen, I think chiropractic is the most amazing philosophy. It really is. It's
Completely.
it's an
No doubt.
incredible healing art. I just don't feel it's the greatest business model.
Hmm.
Okay.
Hmm.
So especially with public perception, and we don't have the dollars to really change that the way we need to, right?
Yeah.
From the top down. Everything is
Correct.
from the bottom up.
Yeah.
So this is our model right here. And so what I did was I said, I called my co-founder, Dr. Mike Rubenstein. I said, Mike, I said, I have a really good idea. I said, we should be opening up a laser pain center
Yeah.
in the practice, in addition to the chiropractic side.
Mm.
And it just really took off.
Yep.
Because a chiropractor with a laser is a chiropractor with a laser, attracting 10 to 12% of the population, seeing people from 5 to 7 miles,
Yeah.
okay, still being perceived as a back and neck doctor, and not really seeing patients that may have other chiropractors for other things. But a laser pain center now attracts the other 85, 90% of the population, has
Hmm.
patients traveling because you're perceived as a specialist. I had a patient driving 30, not 30, 3 hours
Right. Yeah.
to my office.
Yep.
Okay. And he wanted to avoid hip surgery.
Hmm.
And I said, his name was Bruce. I said, Bruce, I'm honored that you want to drive so far with your wife 3 times a week to see me,
Yeah.
but you don't have to. I can find a doctor that has a laser between, me and 3 hours.
Yeah.
He says, no, I see. This is what you specialize in.
Right.
So
Right.
it's
And
that perception.
how many chiropractors did he drive by in those 3 hours?
Exactly, 100%. Right?
Yeah.
So, I mean, unless your name is Clarence Gonstead, that's just not going
Correct.
to happen. It's not going to
Yeah.
happen.
Yeah.
Right? But we've had patients that have flown from Bahamas, Jamaica,
Oh,
Haiti
yeah.
to stay with family to get
Yep.
treated in our office under our Relief Now
Totally get
Laser
it.
Methods brand. Okay. And then, you're not limited to the back and neck perception
Yeah.
because we really focus on disc, joint, and
Hmm.
nerve. And as one of your clients opened up a Relief Now disc, joint, nerve center. Actually, our first, I call it the flagship standalone because it's not bolted on to an
Yeah.
existing chiropractic office.
Well,
And
that's my good buddy Jeff Shabovsky.
yeah, and he's doing
And
fantastic.
you talk about all of the iterations that you can go through multiple satellite clinics, gorgeous big building with multidisciplinary medical PT, everything, right? Top first class. And he would say for me for years, Mark, my dream is I want a decompression table. I want one staff member and laser. And he had that dream for a long time. And then
And
he,
he told that to me
yeah,
also for
he's
I
like, I
can't.
swear I'm going to do it. I'm going to do it. And then I mean, when Jeff gets onto something, he is an all-in guy. So
Yeah.
if you go on his social media channel, you'll see video after video after video, and now patient testimonial after patient testimonial, where he is more excited, no joke, than ever to actually be physically in that practice and making it happen. It's really fun to see him at this point in his career. As I said, super successful guy, right? Everything that you could possibly want. And he's like a little kid with this new practice. He's loving it.
Um, you know, Same thing, Mark. Our conversations, it's like if I could only, I just want to get rid of all this insurance stuff and all this. I want to simplify it and just disjoint. I'm like, do it, do it. So, it's funny because yeah, not to just focus on him, but I sent him recently, from my favorite movie, Field of Dreams, right? If you build it, he
Yeah,
will
build it
come.
and they'll come. Yeah.
And that's what I told him. So yeah, so that really, was our next step, which was we call it the standalone or the dedicated
Hmm.
location as
Yep.
proof of concept, which is also leading me to, possibly because right now we have a licensing model.
Hmm.
Okay.
Right. It's not a
And
franchise right now. Yeah.
right. And we may take the franchise route too,
Yeah.
but
It can happen.
one other thing that happens all the time, and I know it's happening in his office, it happens in my office all the time, is that a patient will come in under the Relief Now side,
Yeah.
okay, and say something like, okay, so is it okay if I go to my chiropractor later and get adjusted? Okay. I love that. And I say, yeah, of course. We never try to, take the patient or, I mean, let them, if they're happy with their chiropractor, great. But what
Yeah.
it did was it gives us a whole separate business and a whole separate revenue stream and
Right.
profit center without opening up. Like I would talk to some of the doctors that have joined our group, but prior to joining the group, I would say, you don't have to go open up a Jersey Mike's because I know you're thinking about it. I know you're
Yeah.
thinking about a
Right. Why don't
Subway
stay
because
in your lane? Stay in
right,
your lane. Yeah.
right,
Stay
right.
with
Because
what you
they're so
know.
frustrated
Yep.
with the way, with the way that their practices has been going. So
Yeah.
like,
Hear it all
you
the
know,
time.
yeah, exactly. But listen, every industry changes. If you think about
Correct.
any major Fortune 500 corporation, all big industry, regulations change,
Yep.
right? Consumers needs change, and they have to adapt and pivot to that, and they do it all the time. But why do we think we have to practice the same way for all these years?
Exactly. It's so true. I listen, I remember with my dad, and I practiced with my dad for a few years. And I, in the beginning, and I asked him, I said, Dad, does it ever get easy? Does it ever, stay the same? Do we ever figure it out? And he said, Yeah, the day that you do, it's your last day.
Yeah,
You always have to be changing and reiterating and reinventing. And that's the beauty of chiropractic, right? It is the most, we talked about creativity. It is the most creative profession that you can be in. You want to do geriatric, you want to do pediatric, you want to do laser center. It's the world is your oyster as a chiropractor. So don't sit around sucking your thumb telling us about how hard it is and things are tough and chiropractic ain't what it used to be and I'm going to go work at the joint. You don't have to do that. This is really a tremendous answer for doctors. I love it. Right in, like you said, right in their own practice. You don't have to move
right.
from where you are.
And you have a whole nother business.
Yeah. Yeah.
I mean, some of the numbers, I mean, I'm not going to get into specific doctors and numbers, but they literally are, their revenue is even in many cases exceeding their old chiropractic side. Now, again,
Yeah.
I'm not telling them not to treat chiropractic. Chiropractic,
Yeah.
again, is wonderful, and they should still do that, right? If they love doing it and they're helping patients, and we're getting those patients healthy, yes, 100% continue. But you
And
have a whole nother business under your roof that you may
yeah.
not even be aware of.
And Rob, not only is the revenue increasing, but more important, the profitability is increasing because it's
Yeah,
not what you make, it's what you keep at the end of
right,
the day, right?
right. And it's all
And
private pay,
right.
100%.
So this is one of the things that makes this a super attractive model, is the profitability within this model.
Very much, I mean, very much so from the profit perspective, because you're really not adding much overhead. I mean,
Yeah,
again, you're really, really reaching those economies of scale in
totally.
this model.
I love it. Well, Rob, if folks are interested in relief now, Shabovsky's saying is ditch the drug, skip the scalpel, right?
That's that's our that's our corporate saying.
That
Okay.
is, I love
Yeah. It
it.
actually is a federally registered trademark saying,
It's like
ditch
perfect,
the
right?
drugs and skip the scalpel.
Yeah,
And we supply our doctors with the little challenge coins.
I love
And
it.
and they
Yes,
keep it,
right.
he keeps it in his pocket. And because it keeps you on that purpose of like, why am I doing this? What is the purpose of this? What, and when patients call you and say, and this happened in my office a couple weeks
Mhm.
ago, patient came in on a Friday, and on Monday he said, I canceled my back surgery. Okay.
Wow. Wow.
And the interesting thing
I
is,
get goosebumps just
yeah.
hearing you
And
say.
our chief medical officer of our company, though, is actually a board certified orthopedic surgeon.
There you go.
Okay.
Yep.
But he really, feels that, for non-operative cases, and even if somebody has to have surgery on the post-operative,
Yep.
laser and the other regenerative medical technologies, like shockwave, and we also use decompression, these treatments help to accelerate and amplify the results of no matter what else, no matter else what you're doing.
So
We also
cool.
have the federally registered trademark for non-surgical laser disc decompression.
Ah, there you go.
Okay. So I mean everything goes better with laser. That's the way I look at it.
Yeah, it's
All
true.
right. Yeah. Yeah.
Well, photobiomodulation, man, it's what
That's
it's
right.
all about. You got to get those mitochondria turned on and kicking.
That's
So
right. That's right.
um, that's awesome. Well, listen, I have enjoyed this tremendously. I could talk to you for hours, Rob. Tell me a little bit about what the next step is for folks who are interested in learning more.
Sure. If you want to learn more, just go to thelasermasters.com. All
Yep.
right. Thelasermasters.com. Laser spelled with an S. Some people put a Z there. I don't know why they do that. But thelasermasters.com. You have all of our contact information there. We just
Beautiful.
started a YouTube channel, Relief Now Nation. Please subscribe to Relief Now
Excellent.
Nation.
Love it.
And if you want to learn more, we have a Facebook page, the Laserpreneurs Forum. So
Oh,
it's spelled like
great.
entrepreneur, but Laserpreneurs Forum
Yeah.
that
Yeah.
we let, any doctor can join and just, learn a little bit more about what we do.
Beautiful.
A lot of good little business gems and tidbits there.
Love it.
So thelasermasters.com, Relief Now Nation YouTube, the Laserpreneurs Forum, that will get you started. If anybody wants to reach out to me personally, I will give you my cell phone number, 954-296-8473. 954-296-8473. I am the co-founder and CEO of the Laser Masters, and our brand is Relief Now Laser Centers and Relief Now Laser Methods.
Well, Rob Hannipol, thank you again, as always, for your inspiration. I know that there are folks who are going to really be interested about following up with this. The game has changed, guys. You got to keep up with the game. It's a new game and
Always changing.
always changing. That should be my motto.
Well,
Always.
and we're even adapting, since we started 5 years ago, right?
That's
We're changing also.
absolutely correct. Well, listen, this is Dr. Mark Sanna. Thank you, Rob Hannipol. And I want to thank you all for being with us today. Check out Rob's YouTube channel. I know that I'm going to do that. And make today an exceptional day. We'll see you next time. Thank you,
Thank you
Rob.
so much. Thank you for having me on.
My pleasure.